Hi, I would like to greet everyone. Today it's Sunday, August 21st, 2022. Um, this is a pleasure to come here right now. We are going to discuss about healthy living, about why we want to stay healthy, why it's good for us to be healthy. Again, my name is Yanick Dantiste. I am family nurse practitioner who currently is living in West Palm Beach, Florida. So I have been in healthcare system since long time, since 19, I would say really since 1985, and I've been here in South Florida since 1990. And currently, I'm working in the hospital with elderly populations. So, the topic of today, the health topic of today, it's really what on the board. Why do you want to be healthy? Okay. Um, to me, health is the best uh, richest people can have because without health, even though we have everything else, we won't be able to uh, enjoy it. So that's why I believe it's good to learn, to get all those information we can get, how to stay healthy, how to be healthy, and how to promote your health and help others. It's not uh, about us also. It's about how to spread the news, how to spread the knowledge to help people to remain healthy. And again, nobody's perfect. Nobody has the magic, crystal ball. Everybody we are trying, but again, information, education is the key. More you inform, it's better. You will you will use it, in your um, advantage, and also you will know also what to do if you don't read, if you don't, you know, now nowadays, with the media, with the social media, we have book, we have um, audio books. So the knowledge is there. So it's up to us to go and get them and to use them. Again, so the topic of today will be why do you um, want to be healthy? Why do you want to stay healthy? So we are going to do in introduction, and we are going to discuss health factors or health factoids, and also with those facts, we're going to there's bad news. Okay, with those factoids, there's bad news and there's good news. I I have been reading a little pocket book by Dr. Charles Benz. Um, he is that book is very, is very concise, is very uh, direct, and most of my topic today will be getting from that book by Dr. Benz. As usual, I would like to start with inspirational or motivational words. Why I'm doing that? I think with the inspirational or motivational words, sometimes, not sometimes, most of the time, it help us, to lift up our spirit. Like if we feel like depressed, by reading those inspirational or motivational quote or words that remind us, uh, we are not we are not uh, struggle by ourselves. Okay, we have so many people. They are in the same creation. So by reading those quotes, we can remind ourselves that we are not alone. So for today, the motivational words will be stating like this. Life is not about rich, being popular, being highly uh, educated, or being perfect. It's it's about being real, being humble, and being kind. So, which is true, life is not like, you know, the most important thing is not like being rich, or you being popular, or you being highly educated, or being perfect. Simply, it's life. It's about being real, you being humble, and also you being kind to all others. This is really the most important things we can uh, uh, we can do in life. So um, so let's start with the topic, okay? Why do you want to be healthy? So I'm going to write some stuff on the board, on the whiteboard, so you can remember. Some people they are visual, so when it's written, we can remember them much better. So let's do some introductions um, to health and health factors, or health factories. It's the same thing. So first one, let's do some introductions, okay? Um, so because I live in the United States, so mostly, all my data or my research will come from there. So that little books I was telling you by Dr. Benz, that little book said that about 80% of disease is preventable. So all those diseases we have, okay, 80% we can prevent them. So that, okay, 80% of disease can be preventable. So that's meaning there's 20% we cannot prevent. That's meaning there is 20% of disease we cannot prevent because of what? Maybe age. We cannot change our age. Our sex, we cannot change that, and environment. So some people live, in North America. Some people live in Asia. Some people live in Africa. Can we change that? Maybe not. But some people, they do have the courage, just to move. But most of the time, most of the majority of people, when they, when they were born in the continent, that's where they stay. But some of them, they move. But I'm saying that to say that some factors we cannot change, like age, like your sex, environmental. Sometimes you can change it, sometimes you're not. But the research says 80% of disease, okay, of diseases can be preventable. So that's meaning we can prevent that. Um, and also the USA, the United States, spend less than 5% of healthcare dollars on preventions. Okay, so if we have 80% of diseases who can be um, if we have 80% of disease who can be prevented, so why the United States only spend less than 5% of the healthcare dollars on prevention? So you would think they will give more dollars, to help to prevent those diseases, but this is not the case. In 2016, more than 70% of the population was overweight. So 70% of the in 2016, 70% of population they are overweight, and 60% has chronic illnesses. Okay, so let's bring the board. Okay, so let's remember that 80% of disease can be preventable. Okay, 70% of the population of US populations are overweight. 70%. That's a lot. And also 60% of the population of the US, 60% have chronic disease. So when we said chronic disease, we mean about cancer, diabetic, high blood pressure, hyperlipidemia, those diseases. So we say, okay. So that's a lot. And also, the research shows also that children born after the year 2000, okay, in the United States, children who were born after the year 2000 have more than a 40% chance of having diabetes in their lifetime. And those children will be the first generations that will not live as long as their parents. So you know, the population will get sicker and sicker. So this is a wake-up call, okay? And those statistics come from the CDC. The CDC is the Center for Disease Control. Um, so as we can see, okay, um, if we have 70% of the population is overweight, 60% have chronic diseases, and we said that 40% of children who were born after 2000, after 2000 have 40% chance. Children who were born after 2000, year 2000, have 40% chance of develop diabetes in their lifetime. So as you can see, the population is getting sicker and sicker. So our healthcare system is seriously broken. Okay, and we can't really. I'm been talking with my coworkers, and we can see that. We can see the healthcare system is not the same it used to be 10 years, 20 years ago, because I have been in this country for since 1990 in the United States, and I can see the big shift. Okay, I kept telling my coworkers, the healthcare system is not the same at all. It's oversaturated, it's overwhelmed, people getting sicker and sicker. Now, many hospitals they are on diversion. Diversion means they have to return, they have to send sick people to other hospitals because they are full. So it's very important to stay healthy. It's very important to have to have the knowledge we need to stay healthy, because um, it's going to be hard, to find place. It's going to be hard, even though sometimes, even though the primary care doctors, it's not easy to find them. I personally am looking for a primary care provider, because my primary care provider used to be a physician assistant, and I loved her, but she changed um, group. She's no longer with those groups. She went to dermatology practice. So I lost her. So now I'm looking for one, a good one. I cannot find one. So that's why I think it's very important to know, to really to keep that in heart, how to stay healthy, to know the data. Because when we know whatever we do, when we know why we do it, I think that stay, and we do it from our heart, and we will get result. If we don't know why we do something, we can start doing it and then we slack off. We are not interested. But when we know the fact, we know what's going on. Like we know that 70% of the population, they are overweight, and we know what overweight can lead to. All those diseases the overweight can cause, like diabetic, hypertension, cancer, you name it. So if we try to lose weight, this is an example, and to stay healthy, that's a big plus. Okay. So as we can see, our healthcare, the U.S. healthcare, and by the way, it's not only the U.S. Because I am in the United States, that's why I'm talking about the U.S. But I have, family member in Canada, and it's the same thing. Okay, the healthcare system is the same thing. Is not getting better. So our healthcare system is seriously broken, and and um, and the author was saying that Dr. Ben was saying that unless we fix it very soon, the cost of healthcare will bankrupt our country. But the cost of healthcare is already bankrupt individual, because the number one reason for individual bankrupt in the United States is healthcare. The bill, the healthcare bill is so expensive. So some of them, they have to take money from their house. They have to do what they have to do to pay, especially the one who does have health insurance. Even though you have health insurance, you have co-payment, and sometimes it's a lot. So that's why it's very important to stay healthy. It's very important to know how to. Um, so health factoids. Health factoids is some facts going to help us. Okay, so we are going to talk about the bad news, and we're going to talk about the good news. So the following factoids are presented as a wake-up call. So the bad news and the good news can be a wake-up call for us. Okay, um, who has a doubt. So the following factoids are presented as a wake-up call to anyone who doubts that they too can be either a part of the problems with healthcare or a part of the solutions. Okay, so what are the bad news about health? Okay, and all those things according to research. Okay, all those bad news, I'm going to cite. It's about research. It's about what people say. So the medical professions has scientific evidence to support only 20% of what they do. Okay, this is the bad news. So they only have evidence, scientists' evidence to support 20% what they do. So Dr. Mark Hyman told the U.S. Senate that, quote, "We will not solve the healthcare crisis if we just do the wrong thing better." So he said that Dr. Hyman was saying that if we just continue to do the wrong thing better, the healthcare crisis won't be resolved. The number one cause of death in the U.S. is now, okay, what we are talking in 2018. The number one cause of death in the U.S. is now medical procedures, and prescription drugs. So this is the number one cause of death. So medical procedures like the surgeries and prescription drugs, medications. Also, the bad news also, a salad costs more than a Big Mac because the meat and dairy industry receives 73.8% of all food subsidized, while fruits and vegetables receive less than 1%. So the food who is good for our health, like the fruits and vegetables, they got less help from the government than the meat, you know, industry. So the government subsidize more, you know, the meat industry or dairy a product than the fruits and veggies. So this is according to research. Less than 13% of infants get the vitamin D. Less than 13% of infants get the vitamin D levels they need. So less than 13%. So, and we know the vitamin D level, this is the vitamin who help with the bone health, you know, to help them grow healthy, their bones stronger, and their teeth also stronger. So only less than 13% get their vitamins D level that they need. Antibiotics create deficiency in B vitamins, probiotics, and enzymes. Aspirin, okay? The aspirin destroys vitamin C, vitamin E, and folic acid. It also depletes beta carotene, vitamin D, and essential fatty acid. This can lead to heart disease, stomach ulcers, and digestive cancer. So you see, aspirin is good, but also we have to be careful because it can destroy vitamin C. It can destroy vitamin E, the folic acid, and also that can lead also to heart disease. Okay, when that depleted the beta carotene, vitamin D, and essential fatty acids, so that can cause other health problem, which is heart disease, stomach ulcers, and digestive cancer. Okay, so we can go on and on about bad news about health. Okay, let's say food dyes. Okay, food who content dyes, like colors. They said food dyes. Okay, uh, let me. Okay, so food dyes. Food dyes inactivate vitamin B6, folic acid, and vitamin C. So it destroy them. Pesticides inactivate vitamin C, vitamin E, vitamin B6, digestive enzyme, and selenium. Chlorine inactivates thiamine and destroy vitamin A, C, and E. Fluoride destroys vitamin B1, which is the thiamine, vitamin C, vitamin E, the beta carotene, and disrupt the function of most enzymes. So if according to research, we know all those bad news about health, so you would think that the government would put more money to prevent that, but this is not the case. Um, and also, foods grown with commercial fertilizers deplete zinc, manganese, copper, calcium, boron, and other nutrients. This is all nutrients the body needs. So we know that The foods which were grown with the commercial fertilizer can deplete those nutrients. So instead of having those nutrients in food, we won't get them. Okay. And the Mayo Clinic found that gaining as little as 9 pounds of abdominal fat before age 30 was enough to impair arterial function and increase the risk of heart disease. So when your abdominal fat, abdominal girth is you gain as little as 9 pounds, okay, before you are 30 years old. So that can affect your arterial function and increase your risk of heart disease. And also, researchers found that consuming processed meat like bacon, uh, bacon, hot dogs, or processed deli meat created a 40% increased risk of heart disease. So that's why we always said the processed meat, they are not good for your health because that can cause heart disease. The Journal of Nutrition, okay, says that it was in 2010, so 12 years ago. They had a study in 16,338 people, um, in which in which not one person met all the minimum nutritional requirements. Okay, so the Journal of Nutrition, they took a sample of people, which is 16,338 people. Not one meet the requirement. So that's why the vitamins play a role. Okay, later on, I'm going to speak about vitamins, why it's important, and which one is good, and really the dosage, how you know how much you should take. Only 10% of the population has sufficient level of vitamin D. Only, okay, so for vitamin D is important of bone, for your bone health. So only 10% of the populations have enough, has enough. Okay, so I'm going to do some water. So that's why nowadays you see that they put vitamin D and calcium in juice. When you buy your orange juice, they add that. Your milk, they add it because people really they lack of vitamin D, which is true. Even though in a tropical country, you might think, the sun gives you vitamin D, you might think that people, they have enough level of vitamin D. No, that's not true. When we take their level, they always lack um, of vitamin D. The level always low, so they don't absorb it. For there's many reason why. This is another separate topic. The ozone and you name it, but it's only 10% of the population has sufficient level of vitamin D. Okay, so vitamin D, to protect against illnesses such as vitamin D is good for prevent blood cancer, breast cancer, colon cancer, multiple sclerosis. The University of Minnesota found that frying, grilling, and barbecuing meat at a high temperature could form carcinogen that cause genetic mutations leading to cancer. Even the smoke create cancer-causing chemicals. Okay, so the grilling, the frying, the barbecuing is not healthy. So also when starchy foods like potatoes, rice are fried, a chemical called acrylamide is created. This chemical has been linked to cancer and neurological problems. So when you boil and you roasting your food, it's much better. Coffee is not health food, okay? Even though it does not contain some, it does contain, the coffee does contain some antioxidants, but they don't consider coffee as a health food. Um, it's debatable because some research, they said that coffee, it help with Alzheimer, it help with memory, but some research said it's not. So it's debatable. So you need to go and read about coffee. And some research said one to two cups of coffee a day is healthy for you, but some research said no. But I'm just telling you what I read, what I found. So coffee is not health food, even though it does contain some antioxidants. So if it contains some antioxidants, so it's good for cancer. It also uh, lowers your body's pH, dehydrates the body, constrict blood flow, over stimulates the nervous system. Yes, it's true because personally, when I drink too much coffee, I tend to be very hyper. So I can see why, it's over stimulates the nervous system if you drink it too much. Interrupt sleep if you drink that too much. Increase pain sensitivity and additive and may be a key factor in up to 50% of pancreatic cancer. So that's why they said, I don't know, there's more research needs to be done, okay, about that. So coffee, you drink it in more the moderation because if you drink too much coffee, yes, that can keep you awake. You won't be able to sleep. That can make you hyperactive, and you name it. So you drink it in moderations. A study of African American women found an increased risk of breast cancer of 65% of those who had ever used oral contraceptive. So if a woman ever use oral contraceptive to prevent from getting pregnant, so they have 60% chance of having breast cancer, according to uh, a study. So now it was all the bad news, okay, about the health. So now, what is the good news? So we have plenty of good news about the research regarding health. So we're just going to talk about some of the good news. So we just finished the bad news. So what are good news about health? What we need to know, okay? A study of the University of California, okay, shows that um, found that women who took 4,000 to 8,000 international unit of vitamin D3, which is the same vitamin we call it calciferol, D3. So vitamin D3. Okay, so the study of the University of California of Medicine, of medical school, shows that women who took 4,000 to 8,000 international unit of vitamin D3 daily with calcium reduced their risk of breast cancer by as much as 77%. That's very high. That's very good. So vitamin D and calcium, very good. Prevent breast cancer by 77%. Also, some research shows that in Texas, some research shows that vitamin A, okay, can cure 30% of patients with a rare form of leukemia without using chemotherapy. So it was um, a research from MD Anderson Cancer Centers. This is one of the renowned um, cancer center, MD Anderson. Okay, some scientists estimate that adding other proven anti-cancer nutrients could increase the success rate to over 75%, which is big. So vitamin A. Um, Also, there's a research also shows that um, what trigger heart attack is inflammation, okay, in the coronary artery. That's why people has heart attacks, because that person coronary artery is inflamed. So not the cholesterol like people might think. And he recommends getting tested for C-reactive protein. Okay, this is a lab work called C-reactive protein. That protein shows you, okay, if your cells are inflamed, if you have any inflammations, um, with a good range being, 0.55 to 999. Okay, so also, there's a research also, double-blind placebo research shows that zinc lozenges taking within 24 hours of the onset of a cold can reduce symptom severity and duration significantly, regardless of the type of virus responsible for the cold. So zinc lozenges is good for cold. So that's why we need to know. This is you can buy it anywhere. You don't need prescriptions. So it's good. Um, Claremont University found that the antioxidant in red Mika raspberries were able to destroy 90% of stomach and colon cancer cells in laboratory tests. Um, Also, there's one research, okay, the good news, there's one research, a trial reported in the Gynecological Endocrinology Journal found that folic acid, folic acid is um, you can find it in the vitamin section. Folic acid significantly reduces the number and intensity in hot flashes in menopausal women. So the research shows that menopausal women who complain of hot flashes, the folic acid can reduce that significantly, the hot flashes. So something to keep in mind. And also, uh, there's a American Journal of Clinical Nutrition report that 42% lower risk of hearing loss for people who consume at least 2 servings of fish rich in omega-3 fatty acid per week. So if somebody eat 2 servings of fish, okay, fish rich in omega-3 fatty acid, I can think salmon is one of them per week. That can lower somebody's risk for uh, hearing loss to 42%. So this is good. Nutmeg. Nutmeg is kind of this is a spice. You can buy it, in powder, and you can buy it in. It's like it's a ball. You can buy that nutmeg. So nutmeg is cut. It's a spice. Okay. So the research shows that nutmeg is effective against diabetic neuropathy. So when people is diabetic, um, they will end up they can end up, or they will, by with time, something called diabetic neuropathy. That's meaning the nerves uh, they are infected. Their nerve, most likely the peripheral nerves, their feet, they are complain of burning, tingling, pain, in their feet, sometimes their hands, but mostly their feet. So uh, that's when we call um, diabetic neuropathy. Is burning nerve pain on their feet, and they cannot walk. They're complaining of difficulty to walk. They feel like burning sensation. So they said nutmeg is effective for that. It's good for that. Pomegranate inhibits hormone dependent breast cancer and can help repair damaged chromosome. So pomegranate is good, can help with breast cancer. And other good news also about health is that vitamin C at 15,000 milligram can stop an asthma attack. Vitamin C. Okay. And also vitamin C, as we know, is good for cold as well. Vitamin E has been shown to be better than prescription drugs for non-alcoholic liver disease. So people who has liver disease not related to alcohol, such as people who was affected with hepatitis B or C and end up with liver disease, the research has discovered that vitamin E um, is better than prescribed drugs to treat that. And acetyl uh, carnosine is shown to combat cataracts. So it's N-acetyl carnosine is amino acid. So they said that help to prevent cataracts. Also, a Columbia study found that 5 hours of exercise per week. So that's meaning it's less than 1 hour exercise per week. Reduce the risk of stroke by 70%. So which is a good news. Okay, if you exercise 5 hours, okay, 5 hours per week, that can reduce the risk for someone having stroke by 70%, which is good. A study at UCLA found that taking 400 milligram of vitamin C every day reduce the chance of heart attack by 50%. So you have 50% chance by not having heart attack when you take vitamin C, like 400 milligram per day. Okay. Um, Regular consumption, if you eat regularly cruciferous vegetables such as broccoli, cauliflowers, can reduce the risk of cancer of the digestive organ, which is cancer of your stomach, that your stomach, your esophagus, your colon, that can decrease it by 67%. That's why the research shows. Eating less red meat and processed food while increasing fiber consumption can reduce the risk of colon cancer by 40%. This is very good. This is very big. Okay, so um, you can reduce the risk of colon cancer by 40%. By doing what? You can reduce the risk of colon cancer by eating less red meat and processed food while increasing fiber consumption. When you increase your fiber consumption by eating what? By eating more fruits and veggies, and you eat it less red meat and processed food, you will reduce your risk. Okay, you will decrease your risk of having colon cancer by 40%. That's great. The National Institute of Health shows that diet and exercise were able to prevent 58% of pre-diabetics from advanced to diabetic. So if you eat, balanced food and you exercise, that can prevent you from being pre-diabetic to diabetic. That can reduce your chance by 58%. So it's good. So they said that while the prescription drugs like glucophage or metformin only prevented 38% of people from advancing. So let's say some people, they are taking metformin, has a prevention for not develop full-blown diabetic. So they said the risk only not having diabetic by taking glucophage or metformin is 38%. But if you exercise and you eat lot of vegetables, lot of fruits, fibers, that can decrease it by 58%, which is very good. So other than that, okay, we can go on and on and on. Okay, so the next one, which is very important, is that Parker Hamlin allows they have some workplace, okay, allows each employee to spend up to 10,000 per year on wellness, and has established a national insurance system called CAM to ensure employees have access to holistic and natural health services. So some places, they are big in holistic and natural health services, because there's a research who shows that it's less damage, less side effect, but you really need to follow by a natural health uh, provider who really can follow you, give you the right um, um, vitamins, the right nutrients to take, the exact amount. Okay, you cannot. I mean, you need to know what to do. Yes, the natural health, the holistic medicine is good. It's like to return back to Eden, to the old-fashioned ways. It's good. It's less side effect, less medication reaction. But again, you need to know what to do. You cannot go ahead and start doing it by yourself. There is all holistic health professionals um, out there. Just research, find out which one, and go and tell them what you need, and they will work with you. Um, on that, we will stop there. Okay, so this is okay. There's a lot of reason why do you want, why somebody wants to be healthy. Okay, so by knowing the bad news, like we just do it together, and the good news. Okay, there's bad news in health, there's good news. So let's take the good news and run with it, and read more, inform more, and then find out what we should do for our health, to keep us healthy, because it's important. If we don't have health, we don't have nothing else, believe it or not. Um, so remember, okay, always to promote healthy living by eating right, exercise. Everything counts. You don't need to be uh, guru in exercise, go to the gym and spend a lot of time. No, anything, you can swim. If you have swimming pool at home, you swim. Walking is excellent. Brisk walking, walking, um, yoga, meditate. All those things you can do. You can exercise. That will help. Like if you are in the building, There is stairways, instead of elevators, take the stairways if you can. Let's say you go to a supermarket, try to park as far as the main entrance so you can walk back and forth. The every little thing will add. Also drink, drink your water. You feel thirsty, you drink your water. Yes, alkaline water is better, is much better because the pH, um, you know you need an alkaline, because alkaline water, um, the cancer cell, they cannot um, uh, reproduce. So that's why alkaline water, you can see, is very expensive, but it's healthier for our health. And also try to sleep. Everybody is different. Some people said 8 hours of sleep, but some people, it's different. Everybody is different. It's not one size fit all. Some people 5 hours is good, but the research shows that they recommend, the recommendation is 8 hours per night. Okay, at least that's what they said. But but at least get your rest. Exercise, eating well, and try to reduce your stress. I cannot emphasize that enough, how important it is to reduce your stress. I see people, they are trying to lose weight. They do everything trying to lose weight, but when you start talking to them, their level of stress is so high. You're going to you ask yourself how they're going to lose those weight if they don't have a peace of mind. So reduce your stress level as much as you can. If something is not um, bring it fruitful to your health, to your livelihood, why to keep it? So, you know, try to do the best. If you need counselor, psychologists, they are there. Find help. You can have a good friend you can talk to, but be careful. Um, yeah. So, you know, let's work together to try to have a healthy living so we can enjoy the life that God has given us. On that, I will stop now. Um, the next topic, okay, we will discuss about the reason why to stay healthy. Okay, we have a lot of reason why to stay healthy. Um, which will be the next topic. So on that, I will um, stop for now, and I'm wishing you um, best of health. Bye bye. Yeah, I'm trying to. Okay, bye bye.